Welcome back. This is Devpriya Manoj. Teeth are an important part of our body. They help us to bite and chew the food. They give proper shape to our face and helps us to speak clearly. In addition, white and healthy teeth make our face beautiful. But generally, we do not take proper care of our teeth. We should keep our teeth clean and germ-free. Today, I am going to talk to Dr. Sumant Mishra, a pediatric dentist who will be giving us awareness on teeth and oral hygiene. Before that, I would like to tell more about Dr. Sumant Mishra. Dr. Sumant Mishra is a pediatric dentist associated with the Ministry of Health, Kuwait, since September 2009. Since then, he is being awarded continuously excellent in his clinical appraisals from Ministry of Health. He completed his Masters in Clinical Pediatric Dentistry, MClindent Pediatric Dentistry from Queen Mary University of London, UK. He also has postgraduate certificate courses with honours from University of Helsinki, Finland, and fellowship in laser dentistry, University of Genoa, Italy. Dr. Mishra completed his BDS with gold medal from University of Delhi, India. Dr. Sumant Mishra is an active social worker, a philanthropist, and prefers to spend his weekend or free time pursuing various free volunteer oral health activities. Dr. Mishra is an avid writer on health issues in various print medias, as well as guest speaker on local and international TV channels. His recent project is to convert his adopted village in India into a digital library cum telemedicine center to educate and provide easy and free healthcare access to rural population. Dr. Until, welcome to Little Spoons.
Thank you very much, Devpriya Manoj, for having me in your channel Little Spoons, and we really appreciate your public health awareness programs.
Dr. Uncle, could you please tell us what are the different types of teeth and their functions?
We have baby or milk or deciduous teeth and adult or permanent teeth based on their chronology of eruption in our mouth. And we also have, based on their anatomy, morphology and functions, incisors, canines, premolars, which is absent in milk or deciduous teeth, and molars. For the convenience of our viewers, we have got models with us as well. So here in this model for milk dentition, primary dentition, deciduous teeth, we have the upper jaw and the lower jaw. The front four teeth in the upper jaw as well as the lower jaw, they are incisors, and the function is biting into our food. Next to them, at the corners, upper right and left as well as lower right and left corners, forming the cornerstones of our mouth, they are canines. The function is to tear apart our food. At the back we have premolars, which are absent in deciduous or milk dentition but present in the adult teeth. So we have premolars and molars. They are broad and the function is to grind and crush the food.
Dr. Uncle, we would like to know more about primary teeth or baby teeth.
Primary teeth or the milk teeth or the deciduous teeth are the first set of teeth to erupt in a baby's mouth. They are 20 in number, 10 in the upper jaw and 10 in the lower jaw.
Dr. Uncle, could you please tell us about permanent teeth?
Adult or permanent teeth are the set of dentition which replace milk or deciduous teeth as a child grows. They are usually 32 in number, 16 in the upper jaw and 16 in the lower jaw, if we count wisdom teeth as well. Each jaw consists of 4 incisors, 2 canines, 4 premolars and 6 molars.
I have read about wisdom teeth. Dr. Uncle, what are they?
Wisdom teeth are the third molars or the last permanent teeth to erupt in a jaw, usually 4 in number and usually erupting in the late teens or the early 20s. Because they're the last teeth to erupt, sometimes they don't find enough space in the jaws to accommodate them. So they might be either partially or fully impacted, stuck in the jaw bones.
Dr. Uncle, what will happen if we stop brushing our teeth?
If we stop brushing our teeth, over a period of time there is accumulation of food debris, the byproducts of food debris, as well as bacteria and what we call as plaque, which if calcified becomes calculus, and secondary to that is the bad breath, halitosis, bleeding of gums. There might be cavity formations in between the teeth, on the deep fissures of the teeth, and all this process leads to destruction of teeth and the surrounding structures in the form of gums, bones, diseases. And as we know, during the COVID times, if our mouth is not healthy, if the oral health is not up to the mark, the bacteria might spread and cause diseases in the different organs like heart diseases, diabetes, and other diseases.
Dr. Uncle, what are cavities and what causes them?
Cavities or tooth decay or dental caries are permanently damaged areas on the hard surface of your teeth, which might lead to development of openings or holes on the teeth. Teeth decay are the most common health issue throughout the world, and there might be combination of factors including presence of bacteria in the mouth, frequent snacking, frequent sipping of sugary or fizzy drinks, and not brushing your teeth.
Dr. Uncle, could you tell us about plaques, please?
A dental plaque is a soft but sticky biofilm that continuously forms around teeth. If we don't brush or floss properly, then the plaque can get calcified or mineralized to form what is known as calculus or tartar, which might be difficult to get rid by simple brushing, and only a professional thorough cleaning and scaling and polishing is required. Plaque might be having a combination of bacteria, acids, and food debris, which mix to form a sticky, colorless biofilm.
Dr. Uncle, please tell us the causes of bleeding gums.
Bleeding gums is a sign of gingivitis, which is inflammation of the gums, and is primarily caused by the accumulation of plaque around the gum line. And if improper brushing is continued, these plaques don't get removed and get calcified to form what is known as calculus or tartar, which further leads to increased bleeding of the gums, as well as severe conditions of the gums, as well as surrounding tissues like bones, leading to what we know as periodontitis. But there might be other causes of bleeding gums, including improper brushing technique, ill-fitting dentures or dental appliances, or systemic diseases including leukemia, thrombocytopenia, hemophilia, or vitamin C deficiency in the form of scurvy, or vitamin K deficiency, or sometimes the use of blood thinners in the form of aspirin. Sometimes hormonal changes during pregnancy might also lead to what we know as pregnancy gingivitis or bleeding of the gums during the pregnancy.
Dr. Uncle, what are the signs and symptoms of tooth infection?
So here we are going to talk about the signs and the symptoms of a tooth infection. If the tooth infection is deep, it might lead to a condition what is known as a dental abscess. The dental abscess can be fatal if ignored, and hence the emergency treatment or consultation should be taken at the earliest possible. Because of the spread of the bacteria from the local site throughout the body, using our circulatory system, which is blood, There might be general fatigue, malaise, feeling of unwell, fever, temperature, rapid respiratory rate, breathing rate, heart rate, tachycardia, pulse, and the swelling, the facial swelling might be fatal because the facial spaces communicate with the brain through various foramens, and hence it should not be ignored.
Dr. Uncle, what are your recommendations to protect our teeth?
Protection of our teeth begins right from our home using basic preventive measures like optimal, adequate and correct toothbrushing technique using soft bristles toothbrushes and fluoridated toothpastes. American Dental Association ADA recommends brushing twice daily, at least 2 minutes per session using soft toothbrushes and fluoridated toothpastes. The use of interdental cleaning agents like floss as well as mouthwash is highly recommended. The use of fluoride therapy is also recommended to make our enamel strong. Healthy dietary habits and avoiding excess frequency of sugary intake is highly recommended as well. Last but not the least is periodic and regular visit to a dental professional.
Dr. Uncle, I thank you for your time and giving us awareness on teeth and oral hygiene.
Thank you very much, Deva Priya Manoj and your channel Little Spoons for this extensive and interesting session on oral health for the benefit of our viewers. Even though this is a vast topic, but we try to be precise, concise and as simple as possible for the benefit and understanding of our general viewers. Really privileged to be a part of this campaign, and we wish you, Devapriya Manoj and your channel Little Spoons, good luck in your future endeavors.
Friends, our teeth are very useful to us. We can keep our teeth clean and healthy by taking proper care of them. As Dr. Uncle explained, brush your teeth twice daily, in the morning and at night. Rinse your mouth after every meal. Use a dental floss to remove the bits of food stuck between your teeth. Do not eat too much sweet food like chocolates, toffees, sweets, etc. Visit a dentist for regular checkup. Friends, thank you for watching. See you in the next video. Bye-bye.